Hi, welcome back to All Things Home Care with Dana Arnone. It's time for Ask Dana. Finding the right home care agency is one of the most important decisions that you'll make for you or your loved one. Before you make that decision, consider interviewing multiple agencies. Interviews are one of the best ways to get to know who you're hiring. You'll want a caregiver that is transparent, licensed, educated, skilled, and caring. To help make an educated decision, considering asking the following questions as related to who pays. Is any of this care provided through Medicare? Traditionally, Medicare is not a payer of home health aid services. They are a payer for skilled services like physical therapy, nursing, occupational therapy, and in some situations you do get a home health aid, what they consider a bath aid under Medicare, which would be covered by your Medicare insurance, which means that there would be no out-of-pocket expense. But that is short-term and intermittent care, so just keep that in mind if you're looking for something that's more on a longer basis. What insurance plans do you accept? So there are some agencies that are strictly private pay. Usually your companion agencies are private pay. If you're going through a licensed agency, they do sometimes accept what's called long-term care insurance policies or catastrophic plans. All you would have to do is speak to that intake person, ask them if they accept or if they're licensed to accept any type of long-term care insurance. Usually when there is a long-term care policy, you have one or two ways that you can go about receiving your care. One is that you pay the agency and the agency gives you an invoice and you submit that invoice to your long-term care policy for reimbursement. Or in other situations, the agency is able to accept assignment of benefits on your behalf and bill for services rendered directly to the long-term care policy so that you don't have to have any out-of-pocket expenses. Another question, what is included with the services that are provided? Traditionally speaking, the aides that are being provided will bring their own meals. Sometimes the agencies will provide some gloves or masks right now for the workers, but the incontinency supplies are something that is paid for through the family, or sometimes if you have managed long-term care, the managed long-term care will give you incontinency supplies, or if you have Medicare, a lot of times you can qualify under Medicare with a doctor's prescription for in-home incontinency supplies. But regularly speaking, the home care workers will have to bring their meals. They will have to bring their get supplied gloves and masks to protect themselves as well as to protect their patients. Another thing that comes up often is what about transportation services that are sometimes needed for the aide to get to and from work, especially if families are afraid of exposure to COVID and that most of the workers are taking public transportation. One of the things that you may want to ask if there's any way that you could help support or pay for or contribute to some type of transportation service for your worker so that it'll make you feel more comfortable, the worker will feel more comfortable, and sometimes an agency will help provide that service for you. Another way to receive in-home services is through community Medicaid, which is now through the managed long-term care. If you're looking for community Medicaid, if you think that you're going to be needing services long-term in your home and that money is an issue, or that you think that the care is going to outlive your money, one of the things that you can do is call an agency and ask if they assist with community Medicaid or that application process, because that is another payer source for in-home services. If you are thinking of community Medicaid and that's the route that you feel is best for your families, you may want to talk to an elder attorney or your local Department of Social Services, because the laws are about to change for community Medicaid. Where currently there is only a 3-month look-back period, it's going to be extended to a longer period of time. So if there is any thought that this might be something that you're interested in doing, I encourage you and implore you to please start calling now and get that information for you and your loved ones. Well, that's all the questions that we have for today. Please send any of these questions that you may have to info@allthingshomecare.org.